Gary. So we're now recording. Um, like I said, my name is Jesus, and I'll be facilitating the call. We have a guest speaker today. As you see, here's the agenda. We'll start with introductions, and we'll meet our guest speaker, Fredy, and then he'll lead us through our guiding sessions, and then we'll wrap up and begin talking about our next session in September. So today's guest speaker to help us focus on social network strategy HIV testing is Fredy-Roberts Ramirez. Their pronouns are they, them. And Fredy is the Associate Director of Quality and Best Practices at Howard Brown Health, which is located in Chicago, Illinois. So everyone, please give a warm welcome to Fredy-Roberts Ramirez.
Hey, how's everybody doing today? My name is Fredy-Roberts Ramirez, and I use they, them pronouns. I've been working in the HIV field since about 2007. I've been working with social network strategies for about 8 or 9 years already now. This has had to figure out the way it worked for different communities that I've worked with. In Milwaukee, Wisconsin, where I used to work, I worked for 4 years with Latinx, monolingual, and first generation Latinx MSM and trans women of all ages. And now currently in Chicago for the last 4 years, I've been working with Black and Latinx trans and non-binary women of color from the ages of 12 to 29 years old. So those are 2 different kinds of demographics. Yeah.
Great.
So, go ahead.
Great, thank you, Fredy. Thank you for introducing yourself. So in this portion, if people could do 2 things. One, putting your name and organization into the chat for attendance. And then I'm gonna call out somebody. You're gonna introduce yourself and your organization and your title there. And after that person is done, they're gonna select somebody in the room to introduce themselves. So I'm gonna pick on the first person that wrote in the chat. Kevin Sitter, could you please introduce yourself?
Hi, everyone. Kevin Sitter. I'm with the California Department of Health Office of AIDS, Ending the Epidemics coordinator. And I've got jackhammers and butch men outside. So I'm going to pass it on now. Got to see who's who in the gallery. I'll go down to LA. Hey, Julie.
Hi, everyone. Julie Tolentino, she, her, hers. I'm down here in Los Angeles County, and I'm the Ending the HIV Epidemic Program Manager. And I will popcorn to Claire.
Hi, everyone. My name is Claire Mocha. Pronouns are she, her, hers, and I'm here in Washington State, and I'm the Outbreak Plan Coordinator at DOH. And I'll go to Andrew.
Hey, I'm not sure if my camera is on. Andrew Gans, HIV, STD, and Hepatitis Section Manager, New Mexico Department of Health. I'll throw it to my colleague, John.
John Murphy, HIV Prevention Training Coordinator with the New Mexico Department of Health. And let me get the list of participants. I'll go with Autumn.
Hi everyone, my name's Autumn, she, her, hers, and I work for a small consulting firm called Vicente Consulting, and we provide evaluation support for the DPH's CBO efforts. Let's see, and I will pass to Jen.
Hi everyone, I'm Jen Howell from the Washoe County Health District in Reno, Nevada, and I'm the Sexual Health Program Coordinator. And I will pass to Julie.
Do we have a second, Julie?
I think Julie went already.
Okay.
Okay, sorry. Jonathan from San Francisco.
Hello, good afternoon, everyone. Jonathan Fuchs from, or we're still in the morning, actually. Sorry, Jonathan Fuchs from the San Francisco Department of Public Health from the Genesis CBO program. And Jesus, back to you.
Yes, thank you, Jonathan. So I've introduced myself. Can you please raise your hand in the chat if you haven't introduced yourself? Bev, can you please introduce yourself?
Hi, everyone. I hope you can hear me okay. Are you
Yes,
able to
we
hear
can hear
me?
you.
Wonderful, wonderful. Bev Westman, I'm the nurse field consultant with the Denver PTC CBO team, and happy to be here. And I will call on my colleague, Cynthia, who's also part of our team.
Thank you, Bev. My name is Cynthia Aite. I'm the jail case coordinator for the infectious disease clinic at Denver Public Health. And I guess I will pass to Lori.
Hi, I'm Lori Sela with the Mount TC, and I guess I'll give it to Gary.
And Gary Najaris, San Francisco Get Us Up CBO project. And I think that's everybody. I'm not seeing any hands on my screen.
There's one more person.
Oh, what about Joseph Ramirez?
Two more people.
Okay, I'll turn it to Joseph. Joseph? Maybe Joseph's having trouble with audio. How about Frida?
Hi everyone, my name is Frida Rajab. I'm currently the interim shop coordinator and still working for CBOs Get Us Up. Thank you.
Anyone else that hasn't gone?
I think just Joseph, who might have been having audio issues, but Joseph is from Oregon.
Great, Joseph. So if you get that fixed, we can get back to you later as we're working through this session today. So everyone, thank you for introducing yourself and typing your name into the chat so we can take attendance. Now I'm going to hand it over to our guest speaker, Freddie, and they are going to guide us through our guiding questions for the day.
Thank you so much, Jesus. I really appreciate you. So pretty much today we're going to be speaking about SNS, some of our challenges, some of our successes, and trying to speak to each other, trying to figure out like how we can help each other out in each one of our different jurisdictions. So today's going to be like a pretty open call. It'll be like an open conversation where everybody can chime in and talk. So I always ask for everybody to step up and talk a little bit. I'll be calling people out, I'll be calling on people to answer some of the questions that we have today and to share some information. So hopefully we can have a little bit of fun and talk about social network strategies. So the first question I'm going to pose to the group today is just to figure out like what types of populations everybody's working with in their different jurisdictions. So the first question I have is, which priority populations do you hope to reach using social network strategies? And anybody can go first. All right. How about you, California? Kevin, tell me a little bit about the populations you all are working with in California.
Sure. I'm working with 6 different counties, and despite the diversity of the counties, even in geography and their priority populations, the commonalities would be young MSM of color, young gay, Black, and Latinx men, also cisgender African-American and Latinx women, and transgender women and men. Those would be the 3 that I think would benefit most by using social network strategies.
Thank you so much, Kevin. I really appreciate you. Colorado, how about you, Cynthia? Or Bev?
I would agree with the previous answer. And I think I would just put communities of colors in general.
Awesome. Thank you so much, Colorado. Los Angeles, Julie?
Hi, yes. For our EHG priority populations, we're working with Black and Latinx MSM, transgender women, youth under 30, and women of color. And then the last population is people who inject drugs.
So thank you so much. Claire in Washington.
Yeah, I'm not sure. I'm actually really new to this work, and so I'm not sure what our team's strategy has been so far. But I think our populations will probably be pretty similar to what the other jurisdictions have said so far.
Awesome. Thank you so much. And sorry for putting you on the spot.
That's okay.
Welcome to the work. How about New Mexico? Andrew or John?
John, why don't you take this?
Okay, one of the main populations we're trying to reach out to is young Hispanic or Latinx men who sleep with men, because that's where we're getting most of our positives from.
Awesome. Thank you so much. And I have Autumn from San Francisco.
Hi. So I actually don't do direct work. I just work on evaluation for CBOs, so I don't really have an answer to this question.
Awesome. Well, thank you for being here
But
today.
thank you for including me. I'm
No
happy
problem.
to be here.
I'm going down the list of everybody who spoke during the introduction. So now
No
I know for the
problem.
next question. Thank you. How about you, Jen, in Nevada?
Hi, we have been implementing this off and on over a course of probably 4 years or so. The main focus has been on MSM. We are fairly a smaller jurisdiction, so it's been pretty open with that population. But really see the value for people, population, communities of color, MSM, all MSM, and then the trans community.
Thank you so much. How about you, Joseph? Oregon.
Hi. I also don't work directly with our community-based organizations that predominantly do this, but we are working on providing them some strategies or some ideas for engaging mostly populations who use substances or drugs, particularly meth, because there's a big problem here in the Pacific Northwest, also trans communities and Latinx communities.
Thank you so much. I appreciate you for that. I could just let you all know a little bit of my experience is working with young men who have sex with men of color, so Latinx and Black people, from ages from 12 until 65 years old. Also right now, predominantly my focus is on Black and Latinx, trans, and non-binary people of color. So I have a lot of experience in that for like the last 4 years. So I'll pretty much be able to provide some type of information on the things that we do over here in Chicago. So pretty much the next question I have for you all, after seeing that mostly everybody is pretty much working with YMSM of color, cisgender women, trans men and women of color. So pretty much like there's a commonality amongst a lot of the states that we're all working with the same type of target population at this point. So my next question I want to throw out there, and I'll take a volunteer to answer this question, is how are you all ensuring that the frontline staff are reflecting the peers in the community? Anybody can take that question. All right, we'll start with California. Kevin, how are you all ensuring that the frontline staff reflect their peers in the community?
You know, this is one of those areas where the desire has some impediments. Our human resources, first of all, I'm at the state and the funding is being passed through me onto the counties. And so county HR can often impede our goals. Anytime we can't bypass educational requirements or levels of experience, we're less likely to be able to bring in the communities we're working with. It can get a little easier at the community-based organization level, but even there, I see that a lot of people's HR policies are barriers to the goal of bringing people right to the front lines. I just read some grants for another state, and they're data entry requirements was a bachelor's in 2 years worth of experience, and the target population was the ball community. And it's like, damn, data entry, I bet you could take someone who's never had any job or any experience and they could do the data entry. So most of it is about trying to get rid of those barriers and appreciate that life experience is critical, and a person of the peer community is more valuable than someone with a bachelor's in 2 years experience.
I totally agree with you there. I think that's one of those things that we're running into here in Chicago and in Milwaukee, where I was working at. A lot of times, like the people that we need to help us recruit in the populations that we've been given grant money for necessarily aren't people who have got a bachelor's degree or have got a master's degree. And a lot of times I think that with us, how we were able to bypass that was by bringing on people as consultants. So in that way, there's no educational background that's required to be a consultant. So that's just like one thing I can throw out there too, that I know has worked with us in the past. And it still works with us, because I know a lot of times we're trying to recruit people, like at least with me trying to recruit trans women of color. A lot of times, like a lot of them don't trust me because I'm masculine presented and things like that. But by bringing on another Black or brown trans woman as a consultant, a lot of times they're able to engage in ways that I'm not able to. So that's just something I would like to throw out there. Anybody else want to jump in on any types of practices that they're using in their jurisdictions as far as the bypass, like those educational requirements and things when hiring people from community?
Hey, Freddie, it's Bev.
Hey.
I was just going to say we're doing a couple things in our health department that is trickling over to our hospital system. But we did create an equitable hiring tool, and slowly we're trying to encourage HR to rethink, requirements for certain positions, and we as well utilize consultants significantly. So I think that's a great suggestion. But I am always beating the gong of we really have to bring in the community we're looking at serving as part of the staff. Is so important. And we really, we have to put our money where our mouth is, really, in that regard. So thank you for bringing that question forward. And that's kind of a little bit of the work we're doing in our organization.
Thank you so much, Bev. I really appreciate you and the work that you all are doing out there in Denver, Colorado. Anybody else doing anything as far as bringing in people from community? How are y'all all doing that in your states? Colorado? Or how about Los Angeles?
I was gonna say, Freddie, I'm in Colorado.
Oh, you are in Colorado.
Yeah.
My bad.
So you got us.
I got you. All right, Julie from Los Angeles.
Hi, sure. So I'm speaking more on the broader level, not specifically related to our SNS testing agencies, but I know that we're kind of in the same boat as Kevin. We really have a lot of barriers here in Los Angeles County with regards to HR and having specific requirements when hiring. So some ways that we've tried to really encourage our contracted agencies to hire from the community is to include language in our contracts that ensure that the staff hired are reflective of the HIV burden within our community. We are currently working on hiring temporary staff right now and have really been intentional on reducing some of those educational requirements and other barriers, with the hope that we can get more people that are vested in the community, that have lived experience, that are reflective of the populations that we serve. And then I'll just share a little nugget of information. Freddie, thanks for mentioning that consultant piece. I think that's really innovative, and that's something that we'll try to explore here as well. But I recently had a conversation with the New York Ending the HIV Epidemic team, and they mentioned that when they are actually creating their RFPs and contracting out to the community, that they require a very detailed staff retention plan that includes all of those pieces. And that's something that we haven't been as strong in when regards to creating those RFPs. And we do have a lot of staff turnover as many of the other jurisdictions. And so really being intentional in that piece too, and putting the pressure on our agencies to make sure that they're paying people enough, that they're hiring the right people, and that folks are really invested in this work.
Thank you so much, Julie. I appreciate you and all that. I think that's another key point too, is that when you're sending out like the request for funding, to make sure that within those contracts that it's saying specifically that people from community need to be hired in those positions. I know that's what the CDC did with PS 171704, where in that NOFO they had put that people of trans experience need to be the ones that are in those positions in order to do that NOFO. So that really worked out for us out here in Chicago too, with that funding announcement. New Mexico, Andrew, how about you all? What are you all doing to ensure that frontline staff reflect their peers in the community?
So in New Mexico, just like what California said, we're the statewide funder. We don't fund counties, we fund direct providers. So, you know, our state system is not exactly friendly to recruiting the folks we want, the same bureaucracy in terms of experience and getting folks on hiring lists, but our community-based providers are closer to the community, and our state staff working in each region are closer to the community. So we've done pretty well, you know, support them and offering training if they want to bring up young volunteers or others into the roles to encourage that.
Awesome. Thank you so much. I appreciate you. How about Nevada? Jen from Nevada.
We're in the same boat of our HR policies, and we don't fund community programs any longer due to budget cuts. So we unfortunately can't go down the road that everyone's talking about with that innovation, and I'm really happy to hear that everyone's doing that. We are actually, our health equity committee at our health district has taken this exact thing on about our HR hiring processes, and as an agency, what we can do to reflect our community. And so it's a bigger conversation than just our program, which I'm really happy that we're having that conversation. And I think it's going to actually be included in our strategic plan. So it's definitely at the top of our minds, and we wish that things were different, but we live in a county government system, so it's very difficult.
I feel you totally there, Jen. Like, yeah. It's kind of difficult sometimes when you guys have these HR policies or like these restrictions where you can't really hire people that look like the community. So then it ends up becoming like even more of a problem when trying to implement a lot of EBs or interventions to the community and things like that. So I totally feel you there. Last but not least, Joseph from Oregon. Just want to get your take on question number 2.
Yeah, of course. I agree with a lot of people's, and I think we're doing similar things here in Oregon. So much like Kevin and a couple others, like I am also at the state, and we oversee the funding to local public health and their subcontracted CBOs. So a lot of the time we provide technical assistance. And one of the strategies that Javier's on the call as well, he's also my colleague here in Oregon. One of the technical assistance that we're hoping to provide is a social media engagement strategy webinar by hiring social media influencers through either subcontracts or special funding, so that they can run social media campaigns, do outreach, provide at-home testing, and they can reflect, and they themselves are members of the communities we're trying to outreach. So specifically like young MSM or trans folks. So that's just one of the strategies. And we also encourage a lot of our partners to hire for prep navigation, members of the community. So we also have a health equity work group that provides at the state level and within our section, who also talks about HR practices. I think there's a lot of understanding that there's structural issues that, you know, necessarily our subcontractors can address immediately. But what we do try to encourage is to hire staff, you know, for the immediate outreach to do that work.
I love it. Thank you all for your feedback.
Freddie, this is Gary. Sorry to interrupt. Just wanted to share a unique strategy that we're trying in San Francisco. Just in general, folks talked about a lot of the challenges with hiring at the city and county levels. One of the things that we're engaged in, we've been able to engage 2 key unions as partners, representing workers in different classifications. And in conjunction with our HR department, we requested some statistics from our HR department. And what we learned was that a majority of folks in one particular type of classification series called health worker was primarily made up of Black and Latinx individuals who do represent our communities, who have also been working for the city for a significant period of time, some up to 10, 15, 20 years, who have had challenges with promotive opportunities, even within the organization. And then we looked at what we call our health program coordinator job classification, which is normally what we hire into overseeing grants and doing a lot of these kinds of projects, or overseeing a lot of these kinds of projects. And we discovered that that classification was primarily white and female. And so we wanted to look at how, and the 2 classifications are represented by 2 different unions. So the 2 unions and HR are working in collaboration to look at everything from mentoring health workers to providing more equity in salary, to providing more promotive ladder opportunities, and to make the process and qualifications more straightforward for the Higher Health Program Coordinator series, so that our folks that actually do represent the community and have significant experience with our health department actually have realistic opportunities to jump into that higher program series, which runs and oversees grants like this that are supposed to be serving priority populations. So it's a lot of work. It's been going on for a couple of years now. HR changes slowly, but I think it's gotten the attention of some supervisors and the HR director and lots of other key folks. So we're hoping that this leads to some specific changes that make it easier. And we're happy to share specifics of that, like offline, if any other jurisdictions are interested in kind of the template of what we're doing. Thanks.
Thank you so much, Gary. That was awesome. All right, y'all. Is there anybody else that I missed that wants to answer question number 2 before we move on?
Can I add?
Yeah, go ahead, Javier.
Okay. Javier Salcedo at Oregon Health Authority. I did want to add that there should really be kind of looking into what these requirements are for when it says you know, a bachelor's or a master's must be needed. Really getting to the root and talking to HR, talking about, because a lot of times I have found that these things were written in by folks in development or folks that contracted grant writers to make themselves more competitive to get a grant. So a lot of the times it's one of those things where, I mean, I remember overseeing, you know, grants that were written and, you know, in a sense, you're kind of pitching this unicorn that you're going to find that has, you know, different degrees and different experiences and identifies with a certain community. And then you realize that it's completely impossible to find some of these people, specifically when you're looking at BIPOC communities in certain areas. So I would just really get folks to really question HR and question management on like when these standards were made. And I know that there's organizations that have set a standard for like only hiring folks with an undergraduate degree and have like grandfathered people in who didn't, but really looking at the scope of work and seeing that, you know, sometimes it's not about education, it's about like work experience and lived experience.
I love that. I think that's something that they've done here where I work at now at Howard Brown, is that for a lot of the front lines positions, and things for people that they're looking to work as frontline staff. A lot of them, they're starting to add in, but instead of the degree, they put in or this many years experience working with the target population, which then opens up opportunity for people that necessarily don't have degrees to be able to still apply for those frontline entry-level positions. Did you have something to say, Kevin?
Yeah, once you get some people in, HR gets to say, I told you so, if their attendance isn't up to par, if their ability to work a full 8-hour day isn't always there. I think it's important to also appreciate that when we're taking people who haven't worked for some time, putting them into a 40-hour a week workday can be really challenging, and that we need to also appreciate that standards and coaching and how to bring people into the workforce isn't just a on-off button, that there needs to be coaching on how to be able to survive a 5-day week, how to survive an 8-hour day, what to do with crisis management as people transition out of not working and into working. So there's a second stage that's needed so that HR can't come back and say, see, that's why we need bachelors or these people.
I feel you there too. Like a lot of times, I think just from my experience with working with the whole team I hired, now they all are from community, and some of them, this is their first job. I think it's more or less, since we believe in restorative and transformative justice, we bring that around in work practices too, with like when they come to work, like let's say a lot of people that haven't worked before can't normally work a regular 9 to 5. So more or less like talking to them and like seeing like what schedule will work best for them. Okay, I see you can't get here at 9 o'clock in the morning. How about we start you at 11? So then that way you can work an 11 to 7. Because a lot of times frontline staff work outreach, and most of the time the populations that we're serving are not awake at 9 o'clock in the morning. A lot of them are up in the evening or in the late afternoon time. So they're trying to adjust those schedules just until they get accustomed or conditioned to the normal work schedule. And I think that working with people from community too, like if you hire them in, like I know there's a certain standard across the board with everybody, but then also acknowledging that they're coming with the, like, especially what Kevin said, not used to working normal jobs or working 40-hour weeks, and just being understanding when it comes to that point. I love the fact somebody brought up social media influencers and bringing them on to work as consultants and things, but trying to recruit people for social network strategies. I know that is a practice that works well over here with us. Some other things as far as like people that we use for recruiters or frontline staff, or like parents, mothers and fathers from the ballroom scene, actual like hosts of drag shows and things like that work out in the community. Like I can say myself, when I started out in this field, that's how I started out in HIV prevention work, is because I was a drag queen in Milwaukee, Wisconsin, and they seen that I was able to move a crowd and I was an influencer in the community. They hired me on and trained me up, and then I went to school and all the other stuff afterwards. But at that point, just me having that direct tie to people in community and moving people, that's how I was able to direct people into HIV screening and prevention. So I just want to throw that out there. Does anybody else have anything that they want to add on to question number 2? Or else we'll move on to question number 3. All right, so the next question I posed for the group is, what types of incentives are you planning to offer for your social network strategies intervention? And we'll start with Oregon. Joseph.
Sorry, I'm having some problems with my mic today.
No worries.
Yeah, so like I mentioned earlier, I'm personally, not at that level. Our CBOs do it, but we can offer oftentimes cash incentives. So, and we do like to try and get cash back into the community, because we've heard from a lot of different members that that's the most helpful. If we're working with, recently we had an all contractors call, and we had a COVID-19 community response unit that has a lot more funding. So we presented and connected our contractors with with this group because they have funding to provide sleeping bags or hygiene products, as well as Narcan naloxone for people who use drugs. And in the houseless community, there's a lot of real need for just cash, groceries, just basic supplies. So that's one incentive. We work really hard to provide things that, or at least we try to encourage our partners to provide those incentives when we incentivize additional testing. So for hepatitis C and HIV, we try to offer those. When it's out in the community for like young MSM, we also try to offer either cash, or they can get creative. We can't fund vibrators, but we've been trying to for a long time. So
I love that. That is so innovative, cash incentives. I don't think we've even gotten that far here. Like there's so many stipulations around cash. How'd you guys manage to do that?
it's different. So with the CBOs, like I said, it's a little different for every local public health. They also have a lot of barriers to doing cash incentives. So I'm not the expert here. I could definitely come back and share with the group if there's like a process that they're doing, but I think the barriers are at the local level. So yeah, I can provide more information if I find it.
I appreciate you. Thank you. Did you have anything to add, Javier? Before I move on?
No, I do not.
Okay.
You put it greatly.
Cool. I just don't want to forget you this time. So how about you, Nevada? Same question. What types of incentives are you planning to offer for this intervention?
We've done gift cards and would continue to do that just because of the limitations that we have. But we do ask our prevention planning group, we get feedback from them on what gift cards would be useful. And we've had to, depending on administration, we've had to change that up a little bit. Or one thing that we did was they said you have to get gift cards that go to like, so people can buy food and stuff. And so we got Walmart and one of the grocery stores. But then we went around it a little bit by using the gift cards to buy other gift cards that people may like more, like Starbucks or Amazon or things like that, where our administration wasn't supportive of. So we kind of went around that into a very gray area that I hope no one's listening. No, they're not, so I can say it. So that's kind of what we did to get past people's, it comes down to people's expectations of how a community, what a community needs and how a community should be treated. And that didn't sit well with me. So I like to push the envelope and find the gray.
I love it. What was the name of the board that you said you had asked about the incentives?
It's our HIV prevention planning group.
Oh, okay.
Yeah.
Okay.
And so that helped with administration to some degree by saying these are community members that are giving us their feedback and they know what the community needs. And so we need to follow their direction.
I love that. Like that was something I was going to touch on later on, but I like that the HIV planning committee or the HIV planning boards is a good place to start when trying to talk about incentives and things like that. Also having a community advisory board really helps gauge what SNS could look like in different populations, especially two different populations I worked on. I depended on my community advisory board to give me feedback. I was telling Gary the other day that like we're doing SNS and my boss was giving us these Subway gift cards to give to young people. And we were just wondering why the young people were not coming back or not even trying to recruit other people. And it had come out to be that after asking, the young people had said that none of them like eating at Subway. So why would they want to even partake in the, in the intervention? So we had to think a little bit more creative, and that's when we went to the Visa gift cards. And after that, like the young people started referring people because it's like almost like cash. They could use it anywhere they wanted to go or on anything they wanted to use it for. So that was like a learning point for us early on in this intervention when I was working on it. So I just want to throw that out there, Jen. I really like that you are consulting with young people and people from community to see what type of incentives they want. New Mexico, how about you all? What types of incentives are you all planning to offer?
We we actually are allowing our partner agencies to use whatever they prefer. We do allow cash, which frankly is way more popular than gift cards. And in some of our programs, we got in the habit of using Target gift cards, but they're rural parts of our state where there's no Target within 50 miles. So yeah, you do have to think through it. Don't give them food they don't want. And I've learned over the years to become okay with cash.
Right.
I know some of our CBOs like being able to give out cash because they don't want to support the corporate overlords like Walmart and Target. They'd like to support small mom and pop shops, which they can do with cash and stuff like that. At least that's what I've heard some of them say.
Right, I like that too, like not giving money to big corporations. How about Los Angeles? How about you, Julie? What are you all doing out there in the city?
We're in the same boat as some of the other jurisdictions. So while we would really like to give cash incentives, and we've been really trying to push the boundaries with that and work with our project officers, we're really just sticking to gift cards for local grocery stores and other stores based on where the agencies are located and the client is located. So similar to some of the other jurisdictions, Los Angeles County is huge. We could provide different types of gift cards, but if there isn't a Target or a Ralph's near somebody's neighborhood, then it really doesn't make sense. So just trying to be as responsive and helpful to our clients and really checking in with them on what kind of gift cards they would like to receive.
Thank you, Julie. I appreciate you. How about you, Kevin, out there in California?
The state doesn't like cash, of course, and also the state is, for public health reasons, not wanting us to give gift cards out to any place that sells alcohol or tobacco. Well, that really ties your arms behind your back. So we try to ignore that one when we can. I think it's important to appreciate, oftentimes the counties tell me, you know, Kevin, if you mandate this, we have to do it. But if you just suggest it, it's not going to fly with our supervisors. And I'm always asking CDC to mandate me in order that I can work on things. And so part of it is going up the chain and saying, you know, CDC, if you really believe social network strategies is important, let's look at the incentive processes and give us permission to be able to use cash. 2020-10 is much more liberal in its work. And so I've been interpreting things very loosely and allowing counties to do more than I would if I was working under a different grant. So that's helpful. I also think it's important to sometimes do the boots on the ground. We had once, for World AIDS Day in Minnesota, we got swag. We went knocking on the doors and we had these wonderful bags full of gift cards and products from different organizations. You know, MAC Cosmetics is always out there. And so when you can build a rapport with different merchants that will be willing to pitch in at times, you can customize and get some fun stuff out there. And then lastly, I just joined a research study and they've given me something called the CLIN card. And it's a MasterCard debit that they load. And so the researchers aren't dealing with cash at all, but I get to use this like a credit card. And so I think that this company is designed specifically for research and things. So I've been trying to reach them, but they haven't contacted me yet. But clincard.com is a way to be able to work with a credit card that works more like cash.
I love that. Are you able to drop the name of that in the chat box for us?
Sure.
Really cool. That sounds really innovative there. Then you can go away from all of the gift cards and things like that. And you're just able just to load the card with whatever you need to load it, which is really cool. I like that idea. How about Colorado or Washington? How about you all?
Yeah, I was just noticing that Jen put in the chat that they provide gas cards, and I have heard from some of our teams that, especially in rural areas, a gift card to like a gas station, so somebody can use it for gas or just at the convenience store is sometimes the best bet because that's the thing that they're going to have closest to where they are.
I love that. And that works for you all out there, you said, because you're all in real rural areas, right? And how
Yeah.
about Cynthia from Colorado?
So I think in Colorado, we like to do for our outreach team, I think they like to give out grocery store gift cards as well. If CBOs that we work closely with, I know that they can provide sometimes Visa gift cards, which are a little bit easier to use as well. Not necessarily gas card, but maybe bus tickets or bus passes for some of the clients. And then within public health ourselves, not sometimes grocery stores, gift cards, but not a ton of that. And Bev, correct me if I'm wrong.
Nope, that's all the stuff I'm familiar with as well. And I believe we also can use the Clean card. I heard someone mention that. I've never been involved with it, but I think someone in our team is also using that as well.
That is awesome. I've never heard of that before. So you all taught me something today, which is really good. I love it.
There we go.
Thank you all so much. I know that we've been talking about incentives, and I heard that somebody was talking about using their HIV planning groups. Is anybody else out there? The next question is, what input did you get from priority populations to ensure that incentives are meaningful to them? Does anybody want to talk to me a little bit about that? Let's see. I'm gonna go with, let's say, John and Javier from New Mexico. I'll start with y'all first. No, Joseph and Javier from New Mexico. Or from somewhere.
From Oregon.
What? Okay, my bad. I got my notes are all everywhere.
Andrew and John are from New Mexico.
Okay, so
So,
go ahead, John.
So when we first started implementing social network strategy, we actually let the CBOs decide which population they could reach most readily and to do the incentives from there, especially with the cash. But we implemented it in our our CBOs that are doing HIV services, because we wanted to work with their HIV clients first and then go from there.
Awesome, thank you so much. How about Joseph and Javier in Oregon?
So I feel like the last year has been hard for our partners as far as doing outreach. A lot of the capacity has been halted because of COVID-19, pretty obviously. I do know, however, that they had, and I'm speaking about our local public health, so they had community groups or coalitions to get that sort of feedback from people who either worked in HIV services or were members of colleges, to get that sort of feedback. So that's one place that I know directly they get feedback from. Also, in the Portland metro area, there is a national survey that goes on every year, and that's the National HIV Behavioral Surveillance Project, and they collect some good information in their formative assessment that I know has been shared out at times with our local public health if they're interested in learning about those findings. And really it was asking, I think they have 3 priority populations: MSM, IDU, and high risk folks at a higher risk of acquiring HIV through heterosexual activities. So I believe for them, they reach out to community members themselves, and they recruit them through posters, flyers online to ask what's the best way if they were approached to take an HIV test, what incentives are useful or more appropriate So there's a lot of qualitative feedback that was available to them. So I think really just surveying is one of the tools that we encourage our partners to do, whether that's at the clinic, if they have a clinic, or an FQHC. Also during outreach on social media to ask those questions specifically, whether one sort of planned activity or would they attend, a testing night. What would it take? So it's different for each community. And then where in the city or in their neighborhood would be a good place. And, they also ask questions related to stigma. What would it look like if you were seen going into a testing ban? So I think there's just a lot of input that, that's important to collect when working with the community. And those are just some of the ways. But like I said, I think this last year has halted a lot of that work. And right now, currently, we started the new fiscal year and they're just starting up to be able to implement that. But I do think it's important to share that there's a lot of burnout from our partners from having switched and just trying to get back on their feet, and a lot of staff turnover. So I'm not too sure where they are in this process at this time.
Thank you for that. I think that that's something that a lot of different places are going through, almost similar stuff as well. Over this last year, but thank you for sharing. How about Julie in Los Angeles?
Yes, there's a lot of different methods. Since we're in Los Angeles County, we have a lot of different collaboratives, and our local Ryan White Planning Council. We also created an Ending the HIV Epidemic Steering Committee. And that's in addition to just working with our funded agencies, bringing folks together to really get insight on what's working and what's not working. And we're fortunate that we do have all of these different groups and community advisory boards that are true advocates within our county and are not shy to speak up on what they need and what works for them. And so we really just try to work with the community and have them drive our programs in general. And that's related to incentives as well.
Thank you so much for that, Julie. Kevin?
I think the CBO, the closer to the front lines, the better the accurate information is. And so the hard part is it's tough to ask, what would you like as your incentive if you've got some parameters and barriers, like, sorry, cash isn't one of the options. And so I just think it's important when we're putting it out there and asking that we set up the parameters clearly, so people, both the person asking and the people answering, don't get set up for disappointment.
Thank you so much for that, Kevin. I appreciate you. How about Claire in Washington?
Yeah, I wasn't too directly involved in this process, so I can't speak to it specifically, but I do know that we have some different community advisory boards who have weighed in on that.
All right, yeah, I think that that's the main part though, when trying to figure out what incentives look like and when incentives are meaningful, talking to the people that you guys are all funding and making sure that they have community advisory boards, or that they're actually speaking to the community about the incentives, because a lot of times we notice that this initiative doesn't work if we're just trying to give the target populations things that they don't necessarily need. So I would just try to wrap in as much people from community as possible, especially since a lot of the work that we're doing is to benefit them. So we want to make sure that they're walking away with something that's meaningful and wants to leaving a good impression on them. So then that way they're able to refer other people and make them want to come back. Because I know, let's just per se, here at the center where we work at, we were giving out these Adidas slides for a little second. And we gave a couple pairs out, and before we knew it, we had a line down the block of people coming to get these slides. And it's because something that they needed and they wanted. So more or less, it's trying to find little innovative ways to try to incentivize people for this intervention. And I think it's different in every area. But the cash stuff sounds pretty cool. That Clin card is something that I really feel would be beneficial to a lot of people, especially if you're not able to give out cash in your areas. And I want to thank Kevin again for dropping that information down in the chat box. So if anybody needs that info, y'all can get it from there. I know we're running low on time and I want to get to our last question. So the question is, how do you envision keeping track of the incentives provided to incentives? So this is just to hear about like your tracking systems and things that you all do in your areas to track incentives. So we'll start with Bev from Denver.
Well, that is not something I've been particularly involved with, so I don't know. I honestly don't know. I know in our department that goes, all things, anything that involves money goes through our administrative team. So it's really kind of outside of our smaller team. Cindy, I don't know if you have any ideas about how people track incentives.
So there's two separate trackings. We have to provide a receipt for, gift cards or bus tickets, for example. And so for the person who gives out the gift cards, we have a tracking sheet. So we just get the participant's name, the date it was given. If it's a bus ticket, we have to track down the bus tickets numbers. Just that kind of stuff. And then we have to submit that paperwork, I think once or twice a year during site visits for fiscal reviews.
And how, like, when you guys are like, I know like for us out here, we use like little tickets, like that people are able to give to the people that they're recruiting. How do you all do that out there in Colorado? Is that the same type of system that you all use?
I think so.
Okay. I love that. All right. How about you, Julie, in Los Angeles? How are you all envisioning keeping track of incentives provided to participants?
Yes, I'm similar to Bev, where I don't know the full details of how we're tracking. I do know that our SNS contracted agencies, if they are planning on providing incentives, they need to submit an incentive plan. And then they also have to submit monthly reports where they're documenting all of the incentives that they're providing, if it's related to financial incentives, so the gift cards and other items like that. But unfortunately, I don't know any other details beyond that.
Awesome. Thank you so much, Julie, for that. Andrew? Andrew on the call, so no. How about John?
I know our CBOs, they've created tracking logs, and they're using referral cards with basically codes on them to track which incentive goes with which client. But I think basically it's just something simple right now. It's like an Excel spreadsheet saying, this is the client, these are his numbers, these are the ones that came in. They got, and they're doing a standard, I think $20 for each test that comes in. So.
Thank you so much, John. How about Jen from Nevada?
So we just do an Excel sheet. We have to track from purchase all the way down to having the client sign. And I encourage them to make their signature as illegible as possible, or whatever. That just has to be something on there. So it has to, like, every level of staff that it goes through has to be signed out to them. We did have to go through a really extensive process to allow the use of incentives until we had it in our contract from the state, but it was mandated. And so one thing I wanted to throw in there was, one thing that we did was a survey at our testing sites of what, if we were to provide incentives, what would they look like? What would people want? And so that was why people were doing their counseling session, they would throw that question in there. So I wanted to throw that in there as well. But we do have to have them sign something that says that they're not going to use it for alcohol or tobacco. And I just roll my eyes and tell them to go and be free.
I love it. Thank you for that, Jen. I think that a lot of times too, like we can't police what young people are doing with incentives because they're coming in on their own free will to help us do things for our scope. So it's policing what we're giving to them and what they're using their money on for coming over to support us and also getting HIV tests. We can't really tell them what they can and can't do once they leave out of our site. So I just want to throw that out there. I know there's certain laws and things where you all work at, and I'm not saying to go against any of those rules, but it's just more or less trying to make things easier for the people that are coming in for these interventions. How about you, Joseph from Oregon?
Hi, yeah, I'm in the same place. So a lot of the times the LPHAs have, the state requires that they provide an incentive tracking procedure. So we can request that at any time. And the LPHA usually outlines the procedure, and it most often includes a gift purchase request, inventory log, and a disbursement log. And I just wanted to make a correction. So the special needs funding is non-cash. So I made a mistake there. I just looked it up. Javier's a little bit more savvy about that. So if we have questions, he's aware of that. But yeah, so it's usually just an Excel tracking sheet, and their process for giving those out. And we also encourage them, if it's to just put their initials as a signature oftentimes, so they can't be matched back to them.
Thank you so much.
I'll add that with incentives, it is, I think as you mentioned, it is good to really see if you're able to provide something tangible outside of, this card that could be used somewhere else, or even an experience. I used to manage a program under 15-1502, and a lot of these programs are very incentive heavy, but sometimes these incentives could be an entrance to a drag show. It could be, a photographer, like a photographer to do headshots, like a number of things. If you really hone in on the community that you're doing work for, really seeing those things that they want an incentive for, versus, you get a Starbucks gift card. And I mean, for myself, who goes to Starbucks every day, it's great, but everybody else, a lot of the times they're like, well, I don't even drink coffee. I don't even eat at Subway, as you said. So really seeing that, that we utilize these incentives, and we've kind of really made it to where like it's gift cards, but we really need to look outside of that. Even supporting your local businesses and your local bars, your local, be like, okay, this is, a $5, you could get a $5 food item or whatever it may be, a $10 this, your kind of future entrance. And I know that, there's a lot of limitations with alcohol and tobacco, but really seeing that you're able to utilize this, or, if there's a local vendor that's, that's making screen print t-shirts, that, that an incentive is that, that this vendor makes one of your program and you're able, and that people want to wear it, so really utilizing incentives for the betterment of your own community and the uplifting of your community, because a lot of the times we're not doing that. We're seeing this, we're just feeding money back into, to Starbucks and Safeway and all of these huge corporations that are making money, where we could really be supporting our own communities.
I love that, Javier. You hit it right on the head about being innovative in ways that we're incentivizing. Like you said, paying people's admission into drag shows, especially if you have a drag queen who is a social networks recruiter. That would also help benefit the area where they work at and things like that, by paying admission for people who are getting screened to social network strategies. Another thing that we've used out here was paying for people's admission to balls, to the ballroom scene and things like that. That works out. Also, even having like testing parties, like screening parties, where like you have the recruiter have a party and you bring a couple pizzas and there's a whole room full of people you set up in one of the bedrooms in the house, and you just screen people at the house. Like instead of them coming to you, you going to them. That's another type of recruitment strategy that has worked for me over here in Chicago. But Javier, thank you for bringing up that. I really appreciate you. And last but not least, I want to give Kevin from California a chance to answer the last question before I turn it over to Gary and Jesus.
Well, most of it's ditto, document. I think I coach people to get around that sense of privacy for people receiving the gift cards or incentives. They can keep a code numbering system, but as long as at the office, there's a locked set of, these are the names and these are the codes. So all we see are codes, but we could go back to a list of individuals if we had to. So that confidentiality piece can be sustained that way. And then the other piece is buddy system. I don't want to set anyone up for potential scandal by having some lost incentives or something. And so I really encourage, when we're going to be dispersing incentives, to try to make it in a buddy system so that there's 2 staff members that can count them in the beginning, disperse them, count what's left, and bring it back, just so that no one's really vulnerable to the scandal that could come if we lost incentives.
Thank you so much, Kevin, for that. I really appreciate you. I want to thank you all for coming today to this SNS circle and speaking. I had a really awesome time talking with all of y'all and learning a lot of stuff that you all are doing on the west side of the United States. I really appreciate y'all. I'm going to turn it back to Gary and Jesus.
Thank you so much, Freddie. So all of you on the call will notice we're slightly new model for how we're doing the West Region Learning Community. So moving forward, it's going to be much more, the 3 CBO providers have worked together to pick priority topics that the majority of you had in common for TA implementation needs in your jurisdictions, based on what was in your JCPs, as well as the June call when we presented some stuff to you and you also prioritized. And so one of the biggest ones in terms of training, EBI implementation, and just technical assistance in general on a singular topic was SNS. You'll see that we have this new model where we're bringing in one of our CBOs specialists on the topic. One, so you get to know that person deeply and well. So thank you, Freddie, for joining us. Freddie is our TA provider, along with Christopher Stojanowski. Christopher focuses a little bit more on the structure of the model of SNS and really how to understand, interpret the model, the incentive kind of rubric, and some of the tracking and evaluation pieces. And Freddie is our amazing community expert on working with staff to implement, looking at what actually works in the community and helping problem solve strategies that come up. So and you'll also see that we put out these guiding questions in advance of the discussion. Those are going to be coming out routinely for all of our calls moving forward. It's critical that you take a few minutes out of your time when those questions are sent to really jot down some answers, because we really are going to be going through the peer-to-peer sharing as Freddie was guiding us through, because it's important to hear from each other and suggestions from each other. And I've been taking notes as we've been going along and highlighting a lot of the suggestions that each of you have been providing, so that we can capture those in the notes and in the recording that we put up in the on the learning community in group site. And thank you, Freddie, for guiding us through. We percolated between the CBOs and with Freddie, and just looking at SNS implementation as a whole in the US, of where people had the most challenges at the beginnings of implementation with SNS. And some of the biggest challenges came around developing meaningful incentives, incentives that reflected the desires of the community, being able to manage those incentives effectively, as well as like having staff that represent the community and slogging through all those hiring processes so that you actually have frontline folks that reflect the priority populations that you're trying to serve. And then knowing from the start who your priority populations are and how to really zero in on that. So Freddie, in this very conversational and engaging way, has walked us through 3 of the biggest obstacles to SNS implementation in the US and what we've heard from feedback in our region. And I love, Fredy, how you facilitated it with that very drawing in all the suggestions and thoughts and challenges and barriers that each of the jurisdictions on the call is experiencing. So we have two options at this point for you all as a group. So number one, these kinds of learning community sessions can be followed up with individualized technical assistance for your particular jurisdiction based on what's in your JCP, things that you specifically asked about SNS or help for SNS, and Fredy and Christopher will be your amazing guides through that work. Or we could do a group TA session, so not as formal as a learning community, but a group TA session for those who are interested. A number of almost 13 out of 15 of you in the West had SNS questions in your JCPs. So we could do some follow-up group discussions if you think this kind of group context, where Fredy can walk through some of the deeper suggestions of things that they're trying, or where we can look at each of your individual needs and talk through those on a group call. So that's an option. You can also invite some of your CBOs or local health jurisdictions that are actually implementing SNS to those kinds of conversations, so that, because I know, as you all were saying on the call, a lot of you are overseeing and monitoring, but assuring that processes are in place. We're happy to have those other folks on those group TA calls. So think about that. Think about where you want to go next. Fredy and Christopher will be reaching out to each of you that had individual SNS items in your JCP, or to those of you who requested SNS training. You've all been referred to Chickatelli and Associates, but then Fredy and Christopher will reach out to you just to inquire about any implementation challenges that you might anticipate as your staff come back for those trainings. I know some of you, like LA and Colorado and others, are doing a ton of training. Several jurisdictions have had folks trained in this, have had staff turnover challenges. Others had some challenges with the model and are trying to refresh what you're doing in your state. So Fredy and Christopher will reach out after this to talk with you all about where you want to go next. An important thing, Jesus put in the chat a link to the SurveyMonkey evaluation for this session. Please take a moment, click on that now while it's in the chat so that it opens a new screen for you. And so you have the evaluation handy, and literally the questions are short, and it'll only take you less than 5 minutes to go through those after the call. And then just as a reminder, our topic for next month is HIV, STI, Hep C, COVID, and anything else integrated testing. So that's going to be the topic. Guiding questions will go out for that for you all to look in. So for July, August, and September, we've been focusing on the diagnose pillar. So a lot of testing stuff, and then our topics, which will get emailed to you shortly for October, November, and December, will be in pillar, and will be focused on preventing HIV infection, mostly around PrEP and some other creative things there. And then January, February, March will be focused on the treat pillar, I believe. So mostly Denver and CAPTC doing some stuff for us there. So look on the group site for the West Region Learning Community for the list of topics to be posted shortly, and reminders, and definitely RSVP to those calls and all of that. But just a huge thank you to Fredy today. Snaps up, emoji reactions. Thank you for facilitation, and look forward to Fredy being able to reach out to all of you for your individual or group needs moving forward. Thanks everyone, and have a wonderful rest of your day.
Thank you, Gary. Thank you, Jesus. I'll see y'all later.
Bye-bye.
Bye, thank you.